Again, welcome to Miami Community Health and welcome to Live Longer with Dr. Anthony Gonzalez. We're in Heart Month and we're talking about heart disease and heart wellness. In 1960s, President Johnson designated February as Heart Awareness Month. Why? Because heart disease kills 1 in 5 people. It is the leading cause of death. And so in order to live longer, you need to take care of your heart. So we are bringing awareness to heart disease. We're going to talk about what heart disease is. How can you avoid or reduce heart disease? What are the risk factors that increase your risk of having heart disease and maybe shortening your life? So to learn about heart disease, we brought a cardiologist. We brought Dr. Ian Del Conde with us. Welcome, Ian.
Thank you, Anthony. Happy to be here.
All righty. So let's talk a little bit about the heart and tell us a little about what a cardiologist does and what you guys take care of, because people think you just really just take care of the heart. You take care of more than that, the vascular system as well, right?
Well, you hit it. The real name of our specialty is cardiovascular medicine because it's cardio for the heart and vascular for every single vessel in your body. So it's the veins, the arteries, and even the lymphatics, which are sometimes neglected. Diseases that affect the heart typically also affect the vessels, and they go hand in hand. So we look at patients in a holistic way, and we try to prevent disease.
And so when we talk about heart disease that kills Americans, what is that heart disease that kills Americans?
There are a few, but the most common cause of death is, the medical term is atherosclerotic vascular disease. I know it's a mouthful, atherosclerotic disease, but it's the medical term that describes the buildup of cholesterol in the arteries. So the same way that if you buy a brand new home, the pipes are super clean. In a 50-year-old home, if you looked at the pipes, there's going to be stuff in the walls. That same happens in our arteries. And even though this is normal, it's a normal part of life and aging, this is also the cause of heart attacks. And when you have too much atherosclerosis rapidly and accelerated, this is what can lead to a heart attack or a stroke or something bad early in life. And that's what we're trying to prevent.
And so we're talking about death. We're not only talking about death from heart attacks, you're talking about stroke. So before we get into the heart, let's just take 2 minutes and talk about what about the other vasculature? I mean, what is the impact of having atherosclerosis or having clogged arteries in your neck?
Yeah,
you know,
it's a great question. So look, at a very basic level, let's just think like plumbers for a moment. The pump is the heart, and the pipes that bring blood to our organs are the arteries. And if the pipes get blocked, that part of the body that is receiving blood flow is not going to get blood flow. So if it's the brain, it's an issue. It can be a stroke. It can even be a cause of dementia. The kidneys can have problems, the bowel can have problems, and the legs can have problems. So any single vessel in the body, artery, can get blocked, and it's a problem. And it's much easier to prevent than to treat. So I'm happy to talk about prevention.
All right. So let's talk about prevention. So we're going to go back to the heart and obviously heart disease, and that's what we're focusing on. What are those risk factors that increase your chance of having heart problems and heart disease as your life progresses?
Critical question. I'll start off by saying that the way that we learned what causes heart disease was a very famous study, at least in cardiology, called the Framingham Heart Study. And for those listeners who don't know, Framingham is a town, is a city west of Massachusetts, or west of Boston, excuse me. And in the 1950s, researchers followed the population in Framingham and just observed what happened to people over the course of a few decades. And what we learned is that the people who had heart attacks and strokes were also the people who tended to be smokers, diabetic, high blood pressure, high cholesterol, and who also had a family history of heart disease. And that's how we understand the risk factors nowadays. Now, we simplistically pull them into that list that I just mentioned. There are many other things that can cause heart disease, but by far the main ones are diabetes, smoking, genes, blood pressure, cholesterol.
All right. So some of them you can control. I mean, you can't control your genes, right?
You can't change your
I've heard that on this show. You can't change your genes. So we're not going to worry about the things that I can't do something about.
Exactly.
Let's worry about the ones that I can do about. Smoking. We can eliminate smoking, right? A little bit of smoking is okay?
None. There is no level of smoking that is safe or fine.
All right. And then diabetes. How do we avoid diabetes?
Yeah, so diabetes, I can tell you that the treatments that we have nowadays for diabetes are dramatically better than what we had even 20 years ago. Diabetes is a genetic condition. There is a genetic component. If your parents were diabetic, there's a much greater chance that you will develop diabetes. If you develop diabetes, there are great medications, but diet and exercise are still critical in the prevention and treatment of diabetes.
All right. So we talked about diabetes and then high blood pressure.
High blood pressure, super common. 1 in every 2 adults in the US has high blood pressure. So we can't change, again, our genes that determine high blood pressure, but by staying at your ideal weight and not consuming excess salt, you minimize the risk of developing hypertension or high blood pressure. If you develop high blood pressure, you just need to get back to a normal number. And whether you use lifestyle or medications, it almost doesn't matter.
Okay. And then we didn't mention alcohol. Let's talk about alcohol. There's been some news recently that, maybe a little bit of wine is good. Now, no wine is good.
Super debatable. Super debatable. I don't think that we have a firm conclusion. I think that we're still in this up and down of it's good, it's bad. I think that what we all agree on is that too much alcohol is bad. Now, what is a safe amount of alcohol to consume? This is what's being hotly debated. The Surgeon General a few weeks ago stated that there is basically no safe level of alcohol that you can consume. But many people disagree with that. And I think that if you just really minimize the amount of alcohol, you promote your health.
Okay. And then, something we didn't talk, you mentioned a little bit about keeping your weight down and obesity and diet, right? Food plays a factor in this. Obviously, food plays a factor because if you eat the wrong types of food, lead to obesity, diabetes, high blood pressure. But, talk to us a little bit about, controlling your weight and what you eat and how that impacts your heart.
I'm super passionate about this topic. I'm super passionate because, unfortunately, in 2025, especially here in the United States, we are living exactly the opposite type of lifestyle that we as human beings were designed to live. Just think about it for a second. Human beings are designed, genetically and just the way our body's built to live something close to the way that a lion in the jungle lives. We eat little, we don't eat too much. When we do eat, it's high quality food, so it's a lot of protein, and there's a lot of physical activity. But the way we actually live our lives is a lot of food of very poor quality and no physical activity.
Yeah.
And that's the reason I'm very busy as a cardiologist. Wow. And there's a multi-billion-dollar industry out there, the food industry. Its sole purpose, and not to demonize the food industry, I mean, we need food, but it is true that the incentives of the food industry are not always aligned with health. And that is the basis of this Make America Healthy Again movement, which, politics aside, there's absolute truth to that. I mean, we need to start thinking about the fundamental things. What do we eat every day? What do we feed our children? And you cannot live your life eating whatever and expecting that it will have zero impact on your health.
Yeah, you are what you eat. There's no doubt about that,
100%.
Right? Now, medications to control obesity. There's been some news and now indications for some of these weight loss drugs. People are, there's this two groups of people. Some people say, the weight loss drugs are great and they will reduce my weight. They'll make me feel happy. They'll make me look good, but they'll also reduce my cardiovascular risk, right? And then some are, don't take that medication because, that's not good for you and it could cause pancreatitis and gastroparesis, paralysis of your stomach. What's the,
So you're referring to, just for all our listeners and viewers, you're referring to this class of medications that we in medicine call the GLP-1 agonists. I know it's another mouthful, but it's basically a group of medications that enhance the effect or simulate the effects of some of the hormones that our own body has. And when you take these medications, a few things happen. Number one, you become less hungry, so you eat less. As you mentioned, your stomach and your bowel They move less, so you just don't, you feel full. You don't want to eat. And it also has some endocrine effects, such as promoting the release of insulin and other things. Nobody expected. So, by the way, this class of drugs has been around for at least 20 years.
Yeah, a long time.
But nobody expected that when the molecules of these drugs were modified, and they had a very long half-life, like once weekly injections, very long half-life, the effect of the medications would change dramatically. And one of the things we learned was they're very good at controlling diabetes. Unexpectedly, they're excellent at weight loss, 15, 20% weight loss in clinical trials. But what really no one expected is that there was also a huge impact in reducing your cardiovascular risk. Even if you're not diabetic, if you're overweight, if you have obesity, and you're on these medications, your cardiovascular risk, heart attacks and strokes, goes down. So I don't like to use the term miracle drugs, but this comes close to something that we've never seen before in the field of cardiovascular medicine.
So in summary, we're reducing our risk. Number one killer in the U.S., heart disease. Then, everything you do, you take a Tylenol,
Right.
a Motrin, there's a risk-benefit ratio to that, right? And,
100%.
There is a negative to the medication, but you have to kind of balance it against the positive.
You said it. There is no medication that produces zero side effects. Everything, even vitamins, have potential risks. But the question is, as you mentioned, the risk benefit. What is the likelihood that this will be good versus the likelihood that it will be bad?
All right. So we talked about the risk factor reduction. You want to keep your weight down. You want to eat healthy, no alcohol, no smoking, keep your blood pressure under control, keep your diabetes under control. God forbid you have diabetes. So what are the warning signs? How do I know I may have heart disease? What are the things that I have to worry about?
So I'll just say before I answer that specific question, to not reach that point, it is important that everyone just know their numbers. For example, that your blood pressure is well controlled, that you don't smoke, that you know your weight, that you know your cholesterol, that you know you're not diabetic. These are simple things. You don't need to see a doctor to know that your blood pressure is normal. You can buy a blood pressure machine in any pharmacy or online.
But you do need to go see your doctor.
You do.
To go
Yes.
get all these other numbers.
For everything
right?
else.
Yeah.
But there's a lot that you can do in terms of prevention on your own. And you should do it. You should be empowered. There's enough out there to really empower individuals. And I hope that programs like this will just alert people about the importance of knowing your blood pressure, knowing what your sugar is, knowing what your cholesterol level is, and not smoking, obviously. Now, what are the warning signs that something could be going on? Once you have a blockage, you will have symptoms related to the organ that is downstream of that blockage. And this typically starts in the heart. The typical symptom that we see is a symptom that is brought on by physical activity and alleviated by rest. So if you're someone who suddenly you start becoming more short of breath or some chest discomfort, primarily when you do physical activity, that is something you should not ignore. If you start experiencing, for example, leg discomfort, leg tiredness when you walk, you should not think, oh, it's just old age, or oh, it's just a pulled muscle. Yes, it could be those things, but it is also important that you have it checked out and make sure that there's no blockage in the artery that feeds that part of the body.
All right. And so you're talking about people having maybe chest pain, shortness of breath, pressure. People talk about this elephant sitting on your chest. Is that still a real good description of what people feel when they're having maybe a heart attack or something, or angina?
That is the event that we want to prevent. So you had prevention, you had the very early symptoms, but when you reach that point where you have that elephant sitting on your chest pressure, that is potentially a heart attack. You should not ignore it. You should head to the emergency room straight away to sort it out.
And if you're a bystander there next to them, you should do what?
Accelerate that process. Call 911. Drive them. Do something. Don't just stand there.
All right. So what happens? Let's talk about what happens. Somebody ends up in the ER with that chest pressure. Talk to us about what happens and what you guys do as a cardiologist for them.
So There are many things, many conditions that can produce the exact same symptoms of a heart attack. So not all chest pressures end up being a heart attack, but you don't know at the beginning. So you have it checked out, you go to the emergency, and you assume it's a heart attack. Assume the worst, expect the best.
Yeah.
So when a patient's coming to the ER, the first thing that we do is quickly get an EKG, an electrocardiogram, and that typically tells us whether it's a heart attack or not. And depending on your risk profile, we will do further tests. Sometimes we do imaging tests to look at the arteries of the heart, coronary CTA, and that will tell us whether there's a blockage or not. Sometimes we look for other things that are also potentially serious that could be explaining your chest symptoms, but are not a heart attack, such as a blood clot in the lungs.
Wow. And so, sometimes these people come in and you guys are whisking them right to the cardiac cath lab, and they have to have an intervention immediately. When is that?
When you have a heart attack. When you have the symptoms, they started an hour, 2 hours, 3 hours ago. You go into the ER, your EKG shows an acute heart attack, no time to waste. No matter what time of the day it is, you're going to the cath lab to get that artery open.
Right. And so a lot of days, a lot of progression in cardiovascular care now, because a lot of it is done what we call through these catheters percutaneously and so forth. And not everybody needs open heart surgery, and even open heart surgery has progressed quite a bit. So what do you guys do in the cath lab, and what type of conditions can you guys resolve there?
Right. So let's go back to the plumbing analogy. So a heart attack is an artery of the heart that has abruptly, acutely become obstructed. There's a blockage with a blood clot. So that heart that is downstream will die unless you unblock it really, really quickly. And the way to unblock it, and this has been extensively studied over the past several decades, the best way to do this is by advancing a little catheter through the arterial system. So you typically puncture either the wrist or the groin, and you advance the catheter back into the heart. You inject some dye into the arteries and see where that blockage is. And once you see where that blockage is, you can open it up. And there are different techniques, but most of the time it's deploying a stent, which is a little metal mesh that goes in, and you open it. You can also aspirate. You can suck that little clot out. We do that for strokes also.
In the neck.
Yeah, in the neck and the brain.
Now, one of the things you keep mentioning, you mentioned a couple of times, the cholesterol, and that has been a point of really, as for me as a patient, confusing. I mean, the old days, you keep your cholesterol under 200, but now it's a little more complicated than that, right? There's all these other LDLs, HDLs. Can you talk to us in a very simplistic, what should we be looking for in regard to cholesterol? Good cholesterol, bad cholesterol?
So I'll start off by saying that this idea that there's a good cholesterol, that has not panned out, at least not at a clinical level. There was a phenomenal information campaign 20, 30 years ago, and it was very effective because people still think that if you have a high good cholesterol, it cancels out the bad one. Turns out that it's not as simple as that. At a clinical level, we cannot measure how active that good cholesterol is. So we sort of ignore that good cholesterol and focus a lot on this so-called bad cholesterol called LDL. Okay. So what is a normal level of LDL? Well, it really depends on who you are. If you're like a healthy, 20-year-old kid, guy, you can have some, you can have relatively elevated LDLs without this being a problem. But if you're older, you're diabetic, in other words, you have risk factors for heart disease, or if you already had a heart attack, we want that LDL to be the lowest it can be, because that LDL is the building block for those blockages. If there is no building block because you've lowered it, then there cannot be any more blockages. So if that happens, then we use medications, and it's important. Diet and exercise are not going to have a huge impact on your LDL. You will need to use medications. We use medications to really drive down the LDL to a very low number so there can't be any more blockages. And
the cholesterol plays into that as well, or
yeah,
how's that?
That's the LDL is cholesterol. It's the type of cholesterol that produces blockages.
So if we bring down the LDL, the cholesterol will come down as well.
Correct.
Okay. And then the other thing we didn't talk about is stress. Nowadays, I think we're more stressed than ever. I think all the information we get, whether it be social media, the news, stress is a big deal. Does stress impact heart disease?
100%. Stress is not good for the body. Your body reacts in different ways that make you less healthy. You release certain hormones, your blood pressure goes up, your sugar metabolism goes off, and it's all because of stress.
And so besides moving to a small town, not getting a TV, turning in my phone, how do I alleviate stress?
That's a great question. I don't know. I tackle this myself. I think that I've heard many smart people say that it is very important that we all meditate every day. I myself do not meditate, but I've thought so much about this that I'm thinking about how do you actually meditate. I think that there's some truth to that, and I do think that with time we'll prove that these sorts of things, such as deep breathing or meditation, are actually incredibly powerful for stress control. But I would start with that. And the other one is, I just mentioned it, deep breathing. There's a fair amount of research into deep breathing that it really has physiological effects. In other words, it really impacts on how your body works. And the way, for those listeners who don't know, deep breathing does carry a specific technique. And just to keep it simple, you take in a very deep breath slowly that lasts 4 seconds. You hold it for 4 seconds and you exhale slowly for 4 seconds. And you do this a few times, and then you do this 2 or 3 times a day. And I think it helps.
Wow.
Blood pressure goes down. You even feel it. I invite people to try it.
Yeah, I was trying it right when you were mentioning it. Now, obviously, the deep breathing you talked about, that the meditation, people say, well, I do this to relieve stress. I exercise to relieve stress. I knit to relieve stress. Or is that true? Or are there other ways to relieve stress besides meditation and deep breathing?
Everyone is different. I think that if you find what you recognize that alleviates your stress, you should do it. And so for some people, it'll be exercising. For some people, it'll be painting or cooking or doing something. Do it. Take care of yourself. Reading a book.
Okay.
Take care of yourself.
Yeah, no, I think that's the thing that we've heard over and over, whether it be no smoking, no alcohol, exercise, eating correctly, rest, sleep. I've heard on this show so many times, sleep is so important.
Right.
Is that it? Does lack of sleep impact heart disease? I know it impacts obesity. It messes with your blood sugar, right? I mean.
So here's my prediction. The same way that we've spent the last 20 years talking about diet and exercise, I think that in the next 10 years, the focus will be on the importance of a good night's sleep.
Yeah.
And this idea that, though it's great because I can get by with only 4 hours of sleep, we will ultimately learn that this is very bad, and it's very important that you sleep at least 6 or 7 or maybe even 8 hours every night.
Yeah, I've heard 7 is like
7.
7 is like
I mean, for me personally, I think it's around 7.
I had a sleep doc here, Meserhain, and he said you need at least 7.
7.
Yeah.
There we go.
Okay, so we've talked about all the positive things and all the good information you've given us. Now, what are some myths? Let's be a myth buster. What are the things that people hear out there, or you hear people say that absolutely, your patients say, Doc, they told me that, if I wave my right arm, it makes my chest pain go away. I mean, I don't know. Are there things that you hear out there that are crazy that you want to make sure that people say this is not the case?
Yeah, love it. Let's start with the first one. High blood pressure, hypertension. As I said, super common. 1 in every 2 adults in the U.S. has high blood pressure. Myth: high blood pressure causes symptoms. Not true. High blood pressure does not cause symptoms in the vast majority of people.
So I thought if your blood pressure's out of control,
ringing,
right?
Forget it. You can have a blood pressure of 250 over 150,
which is
great.
That's really bad blood pressure.
Incredibly high.
That's like stroke blood pressure.
Correct.
Right? Okay. And you have no symptoms. So high blood pressure causes no symptoms. So you said it before, check your blood pressure.
Check your blood pressure.
Okay. Myth number 2.
Let me see a good one. Another one that I would really want to make sure people understand. Okay, so this is an important one. For those people, for those patients who need to be on a statin drug to lower their cholesterol, I don't know what's happening in social media, but the wrong information is getting spread. Statins do not cause dementia. Statins do not cause diabetes. Yes, it is true that in some very large clinical trials, there's a very small increase in glucose levels. But the benefit of statins, if you need them, vastly outweighs any risk associated with that. So I've seen people at very, very, very high cardiovascular risk who've had heart attacks and who hear this myth about statins and they stop the statin, which is probably one of the two most important medications that they should be on based on the wrong information. Now, all drugs have side effects, as we mentioned. If you develop a real side effect to statin, which could happen, talk to your doctor. There are alternatives, there are options, but don't just ignore it. It's a very important medication.
Yeah, I mean, I've been called by a cardiologist telling my family member does not want to take a statin and that you need to know that it is important that they take it. I mean, yeah, that is, but there's a muscular pain also with the statins. Is that the case?
It can happen, yeah. So I actually experienced this myself. I once tried to take a statin, so I know exactly what this is. If you feel very sore muscles, like you have the flu, but none of the other symptoms on that, no fever, but very sore muscles, that's a very common side effect of statins, especially in younger people who exercise. If you develop that, we can adjust the dose. It doesn't mean that you're allergic or intolerant to statins. It just means that that dose is too much for you. So we can play around with the dose or switch you to a completely different class of medications. But it is true that some people do develop muscle aches.
All right. Well, I think we've learned quite a bit about heart disease. I think, we've educated the community. We've tried to bring awareness of this big killer. We've talked about reduction of the risk factors and preventative medicine, which is what you want to focus on. And then we've talked about some of the warning signs and getting to the ER immediately if you have that chest pressure.
Correct.
Right. And so, of course, I think it's been great information. Ian, thank you for being with us here today. Thank you. And Dr. Anthony Gonzalez, on behalf of Dr. Ian Del Conde and on behalf of Miami Community Health, helping you get more information to live longer. Protect your heart. Take care of your heart. Take care of yourself and your family. Have a great day and have a great